Hi there, it's Stacy Johnson, a play therapist in Lawrence, Kansas. My practice is Lawrence Play Therapy. I wanted to jump on here today and post a video about dysregulation in children and some ways that you can help your child to manage themselves and their emotions and body when they become dysregulated. So, what is dysregulation? We hear that term, and sometimes it's hard to define what that actually is. So, dysregulation is really when our brain becomes overloaded with stimuli, and it kind of sends us into a state of alarm. So, for some kids, dysregulation can happen when they have too much sensory input. So, for example, if it's a child that doesn't like loud noises and you're at a football game or a basketball game and there's a lot of loud noises, then, that might be dysregulating for them. On the other hand, another child might become dysregulated just because they're having high emotions or a high emotional reaction to a certain circumstance or a situation. Most of the time when I hear about dysregulation from parents that I'm working with, it is because their child is upset or angry about some kind of limit or boundary being set, and the child then becomes dysregulated. And their emotional state is high, they're not really within their window of tolerance. Window of tolerance is another neuroscientific term that we use to describe kind of the window in which each person can feel calm and collected. Outside of your window of tolerance would be hyperarousal if you are agitated or hyper or extremely irritated, and hypoarousal if you're not getting enough sensory input and you're maybe numb, and even depression can fall into a hypoarousal state, if you are really depressed. So those terms are kind of hard to describe, but they are really just emotional states that we can get into at different times, and we want to be functioning at within our window of tolerance as much as possible, and want our children to be functioning within that window of tolerance, because really to be able to learn or use any other higher functioning cognitive skills, using your frontal lobe of your brain, you have to be within your window of tolerance. And so outside of that, it's really hard for kids to learn. It's hard for kids to accept anything within reason when they're not within that window of tolerance. So we're going to talk a little bit about dysregulation, and as a parent, what can you do to help when your child becomes dysregulated? Now, let me clarify that this can be used really in lots of different situations where dysregulation occurs. I know for a lot of parents, it's difficult to help your child when they're dysregulated when they are extremely angry or upset. Especially if they're angry or upset with you. And I'm a parent, so I understand that as well. However, sometimes that's when your child needs the most support and being able to become more regulated. So really what I want to talk about is there are three steps that you can use when helping your child when they're dysregulated. So the first one is to regulate. So kind of goes along with the dysregulation, regulate. So how do you help your child regulate? Well, it's not going to involve a lot of talking, much to our instinctual nature as parents. when we're trying to help our child regulate, it's not going to involve a lot of talking. It's going to involve much more helping your child soothe and calm down, helping your child feel safe and feel loved. So if they're in a high state of arousal, they are throwing a fit in the middle of Walmart, they are throwing something, they are kicking, screaming, they are making no logical sense. And really what they need first and foremost from you as a parent is some help in learning how to regulate. So helping soothe them. One thing that helps me and has always helped me as a parent and also with the kiddos that I work with through my practice is to think about kids when they're in that state as almost like infants. And I know that maybe sounds bad, but infants really, they cry when they're upset. They become dysregulated quickly if they are not having their needs met. And so we would never try to tell an infant, stop crying. You're hungry. I know you're hungry. I know that you need to be fed, but stop crying. So when I think about trying to respond to a child and helping them regulate, I myself, it helps me to think about, how would I respond to an infant? Because in some ways, when they're in a state of dysregulation, they are not using their frontal lobe, their logical brain at all. They're operating in a lower brain region. They're operating in that fight or flight state, which is where infants, many times are operating. And so, it doesn't, obviously you don't want to, treat your child like an infant, but on the other hand, from an emotional standpoint, you have to think about them as their dysregulation may be similar to when a little baby is upset. And so how would you respond to that? Well, you would hug them, you would rock them, you would comfort them. So many times with children, even 5, 6, 7, 8, 9, 10-year-olds, sometimes they just need you to hug them, to hold them, to rock them, to help them feel, to maybe use some language, but very minimal language. You're okay. This is okay. You're all right. You're okay. I'm here. You're safe. I'm here. Those are very simple words, that kids can maybe hear at that point when they're very dysregulated. They're not going to be able to hear some long, drawn out, lecture about why they shouldn't be upset or why they shouldn't be doing what they're doing or about bad choices. They're not going to be able to hear that when they're still dysregulated and operating in a lower brain region. So regulate is the first thing. The second thing, relate. So after you're able to help them regulate and calm down a little bit, then relate. That step really is focusing on validating feelings. And many times what's important is your tone of voice when you do that and the words you use, but being able to have a lower tone and say, I know this is hard. I get it. You're feeling really mad. You really want to be able to get that toy from the store. That's really hard when you want something and you can't get it. That really is so hard. And man, I can hear how angry you are. You're feeling so frustrated about this. This is really difficult. And really just being able to validate how they're feeling without adding on to that, this is hard for you, but you should, you shouldn't be throwing a fit. You shouldn't be doing this, but you shouldn't have acted the way you did earlier. But you don't deserve to get a toy today. Because the minute you switch into that lecture mode or switch into the, go beyond just validating the feelings at that point, you're going to get some kickback. And you're probably going to send the kid back into dysregulation. And you're trying to, the goal is to try to calm the situation, not make it worse. So the number one priority is helping your child to calm down, validating their feelings, and connection is also part of relate. So you want to find that connection. You know, the child's going to feel safe and safe enough to calm down and not stay in that fight or flight if they feel connected. So being able to help them calm and soothe, sometimes deep breaths can be part of that, and then helping them to feel validated and to feel safe. And then the third step would be reason. So until you can help your child to regulate and you can relate to your child, then reasoning is not going to do really any good. So, you know, those three steps have to happen in that order: regulate, relate, and then reason. So finally, with reason, then you can talk about, okay, what are some different alternatives to your behavior? What could be better next time? If you're in the store and you want a toy and you're feeling upset and you're starting to get mad, what could we do instead? Or you can also reinforce limits if you need to. You know, I know you were upset. It's not okay to throw a fit in the middle of the store. And if you continue to throw a fit when we go to Walmart, you're not going to be able to go to Walmart with me. So reinforcing limits or setting limits can be part of that. But really, those first two steps are crucial. If you are not only going to help your child learn how to work through dysregulation and work through emotions in a healthy way, but also if you want things to go much smoother as far as being able to move through this process and move to a place where you can help your child understand boundaries and limits in a healthy way. I think one of the biggest mistakes or issues that one of the things that's hardest for parents is to work through those first two steps when a child's upset before skipping right to reason. And I do it myself at times, you know, if I'm not on my game. So when a child's upset, and the older the child is, the harder this is. When a child's upset, I mean, it's so easy to just jump right to the reason and say, well, I wish you wouldn't have done that, or you shouldn't have said that, but if they are dysregulated, they're not going to hear that, and they're not going to accept that. And so learning how to help your child regulate and how to relate to your child in a way that helps them to calm and soothe and feel connected, then their brain is going to be calm enough at that point that you can actually talk to them with reason and they can actually hear what you have to say. If you do it prior to that, they're going to shut down and probably, like I said, become more dysregulated. So does this take practice? Yes, it takes a lot of practice. And like I said, the older the child is, the harder it is. I think when you have a 2, 3, 4-year-old, their fits might be horrendous. However, I think parents many times can comfort those children easier because it just feels more natural to hold or rock a 2-year-old or 3-year-old when they're upset versus a 9 or 10-year-old. But I can say from experience, myself and working with families for years, 15 years or whatever I've done, that it can be really helpful to learn how to soothe and help your older children regulate their emotions in a healthy way. And really it has to start with co-regulation. You have to regulate yourself and your own emotions as a parent, and you have to teach and coach your child through learning how to regulate their emotions. So anyways, I've already made this video go 15 minutes. I didn't mean to do that again. So I will stop there. Feel free to send me any messages or leave any comments if you have any questions. My practice, again, is Lawrence Play Therapy in Lawrence, Kansas. You can look at my website, www.lawrenceplaytherapy.com. And hope you have a wonderful day. And thanks so much.